Getting the vaccine out to underserved communities. That was the goal of one clinic in Seattle's Central District today. They targeted members of the Vietnamese community, hoping to help those struggling to access the vaccine, helping them to get a shot. King 5's Amy Moreno live outside a church where Amy, understand that hundreds came today.
Yeah, good evening, Sebastian. This just wrapped up about an hour ago here at this church, a pop-up clinic. A lot of people who came here today were here for their second dose, and getting people to come for a second time shouldn't have been that hard. But with these recent attacks in the Asian American community, they said some of the people were fearful to return for the dose. They actually had to have security out here today. They felt it was especially critical to make sure this population gets vaccinated. Dr. Tweedo says she heard it from her patients over and over. They were qualified for the COVID vaccine but couldn't get the shot.
My patients were having the hardest time trying to get an appointment. There are appointments available, they just can't get to them because of language and technology barriers.
She asked King County for doses, but they didn't have any. Then a month ago, she had 3 days to throw together a clinic.
I got a call that says, hey, we have 500 doses. How much of it do you want? How much of it can you use?
Volunteers from a student group that normally does health clinics in Vietnam jumped in.
Everyone during this time frame may think that vaccinators are the only ones that can make a difference, especially in this pandemic. But in all reality, it takes more than one person to make a difference.
They helped run both clinics and made sure there were translators here and reached out to make sure people returned for the second shot.
We wanted to make it as accessible as possible. So that example that was sending out reminders for people to get their second dose. We made sure that that was in Vietnamese.
They also had to calm fears about those worried about safety after recent attacks on Asian Americans.
So we went there.
Yin Pham was grateful for the pop-up clinic in the church. Last month, she waited more than 5 hours at another site only to be turned away at the door.
Very, very long line. And when we got there, the medical come out and told us, sorry, we don't have a vaccine, no more vaccine, so go home. So we're so frustrated and so tired.
Between the two clinics and shots she's been able to do at her office, Dr. Doe believes they've been able to do 1,500 vaccinations. 1,500 doses, is that enough, or do you think there's a lot more out there?
There's a lot more out there. And especially now that, by Thursday, so many more people will be eligible.
They're not sure if they'll get more doses, but they want to keep supporting outreach, breaking down barriers, and making sure underserved populations get access to the vaccine. And Dr. Doe tells us she believes King County is trying to reach out to those underserved communities, but it's difficult. Sometimes the materials have been translated into other languages, but once somebody starts registering to try and get an appointment, the registration site is often still in English, or sometimes when somebody goes to an actual vaccination site, they have a hard time finding a translator. We're live in Seattle. Amy Moreno, King 5 News.